So good evening and welcome. I'm Harry Hyman. I have the pleasure of directing the GSU DrPH program. I'm excited that about 12, 13 of our current students and program graduates are also here. So we won't play Hollywood Squares and have you try to pick out who's a student or graduate and who's someone who's thinking about applying. But we will spend the second half hour of this program having you go into breakout rooms to meet with our students to kind of hear a little bit of their stories, but more importantly, to have an opportunity to ask them about their experience in the program. And to be clear, I won't be present and or eavesdropping in any of those breakout rooms, so it will be entirely unfiltered. And the stories that come back from that are always quite interesting. But excited to have you join us. I'll give a brief presentation and then I'll also answer any general questions that you might have. And then after the breakout room, we'll come back together, assuming Zoom doesn't lose us anywhere. And any final questions people have, you're also welcome to ask. So I am going to share screen and feel free if questions come up to throw them in chat. I won't answer those while I'm talking through the presentation, but I will look at chat after I'm done presenting to see if there are questions. Otherwise, you can raise your hand and happy to have you ask the question as we go. So I'm assuming everyone can see my screen.
Yes.
Yes.
Yes,
Okay.
yes, we can.
Thank you. Thank you. I just needed one affirmation that was true. So obviously lots of things to think about if you're looking at DrPH programs. And one is why DrPH, and one is kind of what's going on contextually that might make me want to think about getting an applied doctoral degree in public health. And certainly, you don't need to look very far to think about the challenges that we collectively face in public health, the complexity of those problems, and needless to say, the day after the election, what I anticipate will be considerable political challenges ahead to justify the critical work that we do in public health. The pandemic certainly was, I think, what many would consider to be a trial by fire, which we would have hoped would have led to a greater understanding and appreciation of the critical role of public health and a matching of resources to the needs that we work to address. That hasn't, needless to say, fully been realized. But the other thing that I think was a compelling lesson of the last few years, if not longer, is the powerful need for prepared public health leaders. And you'll see on the top, there was an article written by Eric Coles, who's a relatively recent graduate of DrPH training, talking about the need for the best public health doctors, and those aren't necessarily medical doctors, because there's a large chasm between training that goes into clinical care and the training necessary to lead public health agencies and organizations. So if you're thinking about, where are the opportunities for me to be prepared to take on those kinds of roles, then a DrPH program is absolutely the right direction to look. And I would argue our DrPH program in particular. Just to give you a little bit of background about not just our program, but also the School of Public Health, we 2 years ago went through a strategic planning process summarized here, Um, as you can see, really identified our mission to be a premier urban school of public health dedicated to advancing health equity and solving contemporary and emerging public health issues through education, research, and community engagement, and preparing the next generation of not only public health professionals, but public health leaders to advance health equity, as you can see, is our number one strategic goal as part of that strategic planning process. Um, our public health um, our DrPH program is really designed to prepare the next generation of public health leaders and chief health strategists to advance public health and health equity. And it's not by accident that we chose to be a generalist program. If you look across um, other DrPH programs, you'll find that many are focused on particular concentrations. And if your goal is to focus specifically and exclusively on one of those concentrations, then those may in fact be a better choice for you. But given our understanding of the field of public health, the fact that in most public health agencies and organizations, the work of leaders includes engaging across public health science, across programs, across policy. We really feel like a generalist program that prepares you to work across the breadth and depth of public health is critical if your goal is to be in a leadership role. And our program is specifically focused on two primary pillars, leadership development and health equity. And we work hard to integrate both of those areas across our curriculum. As far as the who are we looking for? We're really looking for public health professionals who are committed to developing as leaders and to making a difference. We require a master's degree for most students. It's a master's in public health, but we've had a number of students with non-public health masters who need to take additional prerequisite courses, but have been working in the field successfully. We require a minimum of 3 years of applied public health experience, although 5 years is preferred. And I would say the majority of our students have 10 or more years of applied public health experience. Our program began in August 2018. So we're now into our 7th cohort. And by design, our cohorts really reflect the range and diversity of public health practice and the communities we serve. As you can see here, we have 10 to 15 students per cohort, and they're working across CDC or state public health agency, local public health agencies, academic institutions, including Georgia State and Emory, CDC Foundation, CARE, Task Force for Global Health, Carter Center, and more. We have 20 graduates to date. It's important to know that we have graduates. There's no point in having a training program if no one actually gets through and moves on. And we have 3 more on track for this fall, some of whom are actually in the Zoom call. So kudos. Again, just to give you a sense of the look and feel of our cohorts. We actually have a growing number of DrPH family babies. I'm not sure if it's something in the water at Georgia State or if it's a life cycle thing, but work hard to accommodate students as both their professional lives go through changes and their family lives go through changes. We didn't ask any of these people to smile for the pictures. They're just smiling because I think they like being together and like what we do together. intentionally including the picture on the right, which shows an outing at a local beer establishment, and the person in the front happens to be our dean. I actually didn't get approval from him to show him drinking and carousing with students, but I think it speaks to the culture of the institution that we're going out together, and the dean is choosing to join us. So I think it says a lot about the engagement of leadership at our School of Public Health. As far as the curriculum, there's a requirement for 54 credit hours, which includes 10 core courses, 4 electives, 3 hours of an applied practice experience, and 9 hours of an integrated learning experience or dissertation. And again, across public health, accredited public health programs, you will see the requirement for both the applied practice experience and dissertation. The number of credit hours will vary. All DrPH programs have the same shared kind of required competencies, but then there are what are called concentration-specific competencies, and ours are targeted to our generalist program and our focus on health equity. Again, this is the list of core courses. As you can see, the ones with the red arrows are targeted to the areas that we think are particularly critical given our areas of focus. Those include public health leadership and practice, public health management and finance, health education and workforce development, a seminar on urban health, and a seminar on climate change and the broad implications across public health. And then the other core courses are focused on core areas of public health: policy and advocacy, public health science, epidemiology and biostatistical literacy and reasoning, intervention and evaluation, and advanced research and evaluation methods, and ethics. You'll notice the epidemiologic and biostatistical literacy have an asterisk. So we have a default course that really ensures that, in our view, everyone in a leadership role can work with epidemiologists and biostatisticians in meaningful ways, speak the language, understand the strengths and limitations of different approaches, are able to analyze and understand data. But we also have a number of students that come to us who've been working as biostatisticians or epidemiologists or in other data science roles. So for those students, they have the opportunity to wave out of that course and replace it with a alternative higher level, either epi or biostatistics course. This is a list of kind of the pre-approved electives, but students have the ability for their electives to take any of the course offerings, of course, across the School of Public Health. If it's not on this list, it requires the director's, i.e. my, approval. And students also have the opportunity to take courses across the broader university. So for example, in the Andrew Young School, we have a program focused on public administration. We have a program focused on nonprofit management. I have a student who's getting ready next semester to take a political science course on the kind of landscape for international NGOs, because that's who most of her global work is focused on. So again, there are a range of options for electives beyond even what's offered in the School of Public Health. The applied practice experience needs to occur in a public health agency or organization outside of where your day job is, which doesn't necessarily mean, for example, if you're at CDC or Georgia Department of Public Health, that you need to do that outside of that agency, but it has to be outside of the usual unit where you work with a different supervisor. This is a accreditation requirement that at face value may not make sense from the perspective of, well, wait a minute, if students have, 5 to 15 years of experience, why do they need to have another applied experience? The short answer to that is it's an accreditation requirement. The long answer is we really view this strategically as an opportunity to work on a project and look behind the curtain somewhere where you might not otherwise get that opportunity. So, for example, if you're working with an agency and you're partnering with an NGO, or you partner with NGOs, what a great opportunity to spend some time at one of those NGOs, getting a sense of what things look like from their perspective. Or similarly, if you work at a federal agency, why not get an experience working at state or local, or vice versa. And similarly, if you've been working, say, in programmatic work and you're thinking, I wonder what a policy role would look like. It's an opportunity to get that kind of experience of a different kind of roles. And students have really taken advantage of that. And again, as you meet with our students in the breakouts, I encourage you to ask them about that. Dissertations can be a more traditional research project with primary or secondary data analysis around a current public health problem. There is a requirement for DrPH dissertations that they have relevance to public health practice. So expanding knowledge alone isn't enough. It needs to be something that can actually meaningfully inform public health policy or practice. But in addition to those more traditional approaches, you can also do less traditional things like national or state level policy analyses, piloting and evaluation of a program, comprehensive program evaluations, or evaluation of new approaches to public health problems. And again, encourage you to, as you meet with some of our graduates, to talk to them about some of the exciting things that they've been able to do for their dissertations. This is just a sampling of applied practice experiences. You can see at Carter Center, at Georgians for a Healthy Future, a state level health advocacy organization, at different units of CDC, at DPH. And by the way, I could probably brag on all of these, but DPH annually does a report on asthma surveillance. They've never, prior to 2023, done that analysis, also looking at social determinants of health and social vulnerability, something that was introduced by one of our students as she did her APE. Hopefully something that will be adopted by then. You can see on the bottom right is one of our students who's working in the CDC regional office in the other Georgia, as in Tbilisi, Georgia, who did a WHO convening and reported on that. This is, again, just a sampling of some of the research project or some of the dissertation projects, policy analysis of infection control in skilled nursing facilities. Amy, I love your 2020 a total disaster slide, so I use it every time. A secondary analysis of national survey looking at emergency preparedness. An analysis of preemption and the impact on public health at local and state level. Also looking at the intersection of social vulnerability and COVID-19. This was a qualitative study looking at youth experiencing homelessness and where the gaps and opportunities were to align service provision with the needs of homeless youth. So again, as you can see, a very diverse range of both public health problems and approaches. Again, here's some of the documentation that we have graduates. I also didn't ask them to smile, but you can imagine they had good reason to smile for these pictures. This was our most recent graduation last spring. Just to close, we take our commitment to prepare the next generation of public health leaders very seriously. If that's something that is exciting to you, then I encourage you to come join us.